Let's move on to the next subject, and this is depression. I've had two situations recently. A friend of mine who's quite elderly is going downhill, and everyone is saying, Moose, he's depressed. So in terms of his dress sense, his personal hygiene, everything, it's going downhill. And secondly, I heard of a tragic story at the weekend about somebody who was an ex-banker, split up with his missus, suddenly on his own, he ended up basically dead in a hotel. How can we help these type of people? Can we help them, or are they just lost souls? Is it?
No, we can. I think there's a societal component to helping people with mental health issues. So we've all got to increase our awareness of mental health. We've got to reduce the stigma of mental health, and we've got to encourage people to talk more about mental health. So particularly men often grew up in a culture where you kept everything inside, you know, the strong, silent male stereotype. But I always say the stiff upper lip leads to the cracked soul, because you need to express yourself. Women naturally, historically, have been able to do that. They get together, they talk about their issues, and they offset their issues. So everyone goes through hard times, but sometimes you need to get a new perspective to offset it. Now, if you suffer a depressive illness, that could be a reaction to circumstances, or it could be that you're genetically prone that way. And if you're genetically prone that way, you may need medical help. Now, that medical help may be talking to people, so the appropriate therapist. It may require medication. Now, the medication won't work straight away. It'll take a minimum of 4 weeks because it has to alter the brain chemistry to get it working. In more extreme cases, you may need electroconvulsive therapy, so that's electricity through the brain. And in other cases, there are fantastic results with something called magnetic resonance. So what you can do is you can pulse magnetic resonance stuff into this part of the brain, and they're getting fantastic results. And Yale and Harvard have looked at it, and in some cases, they're getting a 27% cure rate.
Understood.